Hello, Namaste. I am Dr. Meenakshi from Medicover Hospitals, High Tech City. I am an obstetrician gynecologist. Today I thought I would talk to you on white discharge per vaginum, or scientifically known as leukorrhea. We see a lot of patients coming in to OPD with this concern about I'm having white discharge, whether it be a teenage girl, mothers coming with their daughters, or even elderly women, postmenopausal women occasionally complaining of discharge per vaginum. So we thought we would just talk to you on what is vaginal discharge, what is normal discharge, what is abnormal discharge. When we talk about discharge per vaginum, it can be completely normal, like saliva in the mouth is normal. The vagina is a self-cleansing organ, and some amount of discharge is normal. When would we say it is normal? When there is a cyclical variation. The first half of the cycle you may have scanty or a mild egg white kind of a discharge, which becomes a little bit more profuse during the mid-cycle, followed by changing in consistency to a little bit more sticky kind of a discharge through the second half of the cycle. This is known as normal vaginal discharge, does not require treatment, and it is essential or as indication that the hormonal activity is happening normally in your body. When do we say discharge is abnormal? When do you need to come and see a doctor? When do you need to get evaluated? If the discharge is very profuse, if it is frothy, if it is curdy, if it is associated with itching, if it is associated with any foul smell, or associated with pain at the time of intercourse or bleeding after intercourse, please do not ignore these symptoms, as this would tell us that there is some amount of infection which needs to be treated. Why is infection in this area important to be treated? One, because it does affect a woman personally in terms of the discharge, the variety, and the morbidity associated with it. Secondly, also because it can have future implications and complications. Persistent white discharge, which is not treated, can go up the genital tract, can become uterine infection, later on can result even in infertility. Discharge which is profuse and foul smelling in a postmenopausal woman definitely needs to be evaluated, because it may be the presenting symptom of a cervical cancer or a malignancy. So these are some things that should not be ignored, and it is better to be safe than sorry. Whenever you are having white discharge, we also take it as an opportunity to screen you for the cervical cancer screening, that is known as the pap smear. So a pap smear is a small test done on the mouth of the uterus, also known as the cervix, and we can also use this opportunity to give you information about it and prevent cervical cancer, which is one of the preventable cancers in the world, since we also have a vaccine available for it. When you are having persistent white discharge, please do come and show your gynecologist so they can evaluate and treat you and prevent further complications. And definitely use this opportunity to impart knowledge and advise you regarding the cervical cancer screening also. Thank you.